Okay, we're going to be looking at serratus anterior right here. So we're going to take a nice grip here on the elbow with our more superior hand. And we're going to raise it up just so I can kind of show you where we're working. Now, serratus anterior, if you've never had work done on it as a client, this can feel fairly tender. So you can assess with your fingers here a little bit. But instead of working with that digital pressure, we're going to broaden that. We're going to use a full palm. So now I'm going to press down and into serratus anterior, and I'm going to pull the arm up and away. Now, every time I move the arm up, I might change my position a little bit of my more distal hand. I also might change the direction of the pull of the arm. So you can go completely into abduction here. You can go back and get a little bit of scapular retraction. This is going to feel more like a pin and stretch on that serratus anterior. And as we work, finding new positions, because remember that muscle is not just going to span right here, it's going to span all the way down from ribs 1 through 9. So we want to make sure that we're covering all of that area as we're working here. Then after we have worked through serratus anterior, I'm going to move down here. I'm going to pin on glute med and again move the arm up into here. We're going to be opening up this whole lateral side. Should be getting a nice little stretch on the lats. And remember that our body is going to move three-dimensionally. So as we stretch, we're going to get a little bit of rotation, a little bit of forward, backwards to try and put that body in a different position. You might feel something in different fibers depending on if we're a little more anterior, a little more posterior, right? So checking out all of those areas there. Once we've got a good open stretch through the lateral side here, I'm going to place the client's arm back into a neutral position, taking this